Sylvia Global's host, Gael Sylvia, invites you to join her in these conversations with First Ladies of nations' households, business, and communities. Trustworthy, live conversations with women from around the globe provides a place for your voice to connect with women of integrity, passion, and purpose. Now, here's your host, Gael Sylvia.
Is that correct?
You're absolutely positively correct. Initially, we didn't have enough doctors create a database so that we could demonstrate what the difference made. Does it make a difference if you have one of these doctors to call? That was the question we had.
Right.
That's the question the government had. Everybody has that question. So there's an organization called MDVIP, and they have a number of doctors within their organization. They have about 400 doctors. So they had enough doctors to create a database of tens of thousands of patients. They have lots of patients. And what they found, Gail, is absolutely mind-boggling. What they found was a decrease in emergency room visits by 80%. 80. They found readmission rates of, instead of being 15%, which is common in the normal population, in other words, 15% of patients who go home will be readmitted to the hospital. In patients who have our type of practice, only 0.2% get readmitted. These are differences that are more than striking. This tells you how we have changed the marketplace completely. So, because we say that insurance card doesn't buy you anything except standing in line in an emergency room.
Right.
So if you have a doctor to call, you can obviate that visit. You don't need to go to the emergency room. Many times I can just answer the question on the phone. It saves thousands of dollars, lots of time, lots of angst. Obviously, it's an important answer. So we have gone to the federal government and we have told them about this, and we're trying to articulate these changes into what in the United States is the Obamacare thing, whatever you want to call it, the law, because we think there's a better way. We think that we definitely need to rethink the idea of how to access care. Access is through a doctor. It's not through a card. Everything in life is about a relationship. Look, you and I, we've met each other a couple times, but we're such good friends now. You could call me for anything, and I would recognize your voice.
I know that you're at work, and I want to close with a couple of key questions so that our audience not only comes back to you and looks to you as their physician resource through Sylvia Global, but also they help all of us understand the power of the work that you are doing and what it represents, not only for us individually as consumer, as patients, and for the system in the United States, but its global significance as well. Question number one, the economics of what you just described, 80%, it has an economic impact on hospitals and others. Who are the opponents to this type of change? Or are you finding that they're quickly coming on board and still being able to justify their existence and be partners?
Excellent question. So I tease when I say if we really took care of the system the right way, the unemployment rate would go up significantly, because all of those people that are employed in making me do paperwork and fill out whatever, they would have to go find another job. Yeah. So and insurance companies, we save them lots of money, but we also take away their power. So that's where the problem lies. But the data is so substantive, it is so dramatic and remember, it is not things that drive the economy, it's people. And the patients are going to drive this economy the right way. They don't want to sit in emergency rooms. They don't want to sit on the phone with somebody trying to beg to get their medications. They want a doctor too. So what I know will happen is through Sylvia Global is that once the power of the word gets out there, the economics will even grow to a bigger degree. There is no economic or ethical reason to oppose this, because this is about patients, and that's why we go to work. This is about better care, and that's why we go to work. This is about more access, and that's why we go to work. And this is about saving money, and no one can argue with that. So while we have had some people who don't like it very much, it's interesting. They join the bandwagon pretty quickly as they see, and I don't want to interfere with anyone. I truly feel that in America, it's all about choice. And choice is absolutely key. So doctors can choose their mode of practice. You can go to Kaiser. Patients can choose Kaiser. Doctors can work in Kaiser. Whatever suits them is perfectly, perfectly fine. I don't want anyone to feel that I want to impose on their choices. But I want this choice to be available to anyone who wants to access it. That's what I think is important. And the more people who access it, the more people who like it.
Since this is primarily consumer driven and should be in terms of doing what's best for us as consumers and looking at our relationship with physicians as a partnership in our healthcare, is there the possibility that you'll be running for a political office and that we should be planning to cast our votes for you?
Well, I do get that question asked every day. I can't even tell you how many times. Someone's asked me to run for governor, for Senate, and I teasingly say if they just let me be president for 2 weeks, I'd get this place straightened out.
You get it all cleaned up. You get it cleaned up.
Get it cleaned up. But I'm a doctor, Gail. I am my patient's doctor. I have no intent of doing anything else. And I love policy. I hate politics. Yeah. And I tell my friends in government that they don't belong in the exam room. They're not an invited guest. Yeah. And so no, I have no intent of doing that. But I do intend to change the world. And I think I can do a better job from the exam room than I can from a microphone and a platform standing in front of the setting.
Absolutely. And your voice is still being heard and resonating loud and clear in all of these arenas. And we're so, again, pleased to have you here on Sylvia Global Media Network, because we're going to be a part of helping get your voice, your message, and access to this information to people around the world. Dr. Marcy Zwelling.
Perfect.
Got it. Past president of the American Academy of Private Physicians, and most significantly, your family resource physician through Sylvia Global's Media Network. We're so glad to have you on, and we look forward to all of your upcoming guests from around the world, your associates, and the information that you're bringing. You can follow Dr. Zwelling here on Sylvia Global Media at sylviaglobal.com. and send your email questions and texts. She will be live broadcasting, and thank you so much for being here today.
The pleasure was mine. Thank you so much.